So we already talked about the win-win-win situation a little bit. Patient wins because they're going to feel better or they're going to get more prepared for surgery. Do you think it improves outcomes after surgery if you do some prehab? I mean, I think we all think it does. I think we all know it does. At the very worst, it either does or it doesn't. But by not doing it, it definitely doesn't, right? So that's pretty obvious, right? So why not just get more prepared for surgery? It seems like a no-brainer to me. I don't know anybody that, and plus now after surgery, they're like, oh, I already have some experience with some of the moves we're going to do. I mean, it's just a no-brainer. The provider wins. Now the surgeon can say, now look, Mr. Johnson, you got hip OA. It's a big problem. We're going to do surgery probably 3 years. I'm God. I'm the only one that can fix you. But until then, instead of going home and taking Vicodin for the next 3 years, what we're going to do is we're going to send you down to Morgan Denny. She's going to do this crazy ball stuff and some other hands-on things. She's going to wrap a belt around you and yank on you and manipulate things and look at your feet. And we're just going to unload them. We're going to make them more peacefully coexist with that pathology until they're ready for surgery, until the therapy with Morgan, the steroid shots, are just not doing enough anymore. And if they're 60, 60 to 70, those are years I don't want to waste. If you're 61, you've earned the right to have your surgery, Don't sit there and be a martyr for 10 years and now you're 70, you just lost a decade. And I just don't, so again, there's a lot of factors involved there. We talked about how statistically, we're not going to talk statistics except for a couple here. It's about 3 to 6 years. The majority of patients are not candidates for hip replacement for 3 to 6 years. That's a long time to be bummed out. We know that the rates are going up big time. What if you're 44 years old and Dr. Hertzka or Dr. Wagner tell you that, hey, you got this labral tear, you got a CAM, lesion. Great, I've heard arthroscopy is really great for that. Yeah, it would have been for you if we would have saw this 7 years ago, but now you're 44 and you have this little bit of arthritis in there. You're like, come on, man, look at me, I'm 44, I don't have arthritis. Well, yeah, I know you don't feel like you do, but you do. And if we do the surgery to you now, that could, from some people, right, we've seen them stop doing it to certain people because it triggers this crazy response where the body starts laying down bone, doing crazy degenerative things, and next thing you know, they're in a hip replacement a year later. You're like, wait, what just happened to my hip this year? We just went from being mobile and in pain, but at least doing stuff, and now I'm having a hip replacement. So now it's like, what are you gonna do with those people? And then the doc says, well, your next surgery is a hip replacement. We just can't do this arthroscopy to you, but we'll give you a steroid injection. We'll send you down to Morgan. Okay, so that's great. You want to do that, but now they might have to go 20 years of peacefully coexisting with this problem. Hip replacements aren't very sexy anymore for surgeons. They're looking to make more money in cooler shoulder and knee surgery, stuff like that. So the American Academy of Orthopedic Surgeons, they're predicting a shortage now, and they're seeing that the young docs aren't going into joint replacement. So now we have this massive increase, and we have this massive decrease, and we have this huge void. And check this out. About 90% of people with knee OA get referred to physical therapy before and after surgery. What percentage do you think gets referred for after hip replacement or before hip replacement? Does anybody have any wild guesses?
25.
Yeah, exactly. It's like 10 to 30 at best. That's crazy. It's like, really? It's 2016. So we're starting the hip revolution, you guys. This is on us. We got to get out there and market that we're not treating the arthritis, Dr. Sparling. We're treating the impairments around that arthritis. It's just that simple. Better outcomes, maybe. No other options for some. Yeah, Mr. Johnson, you need a hip replacement, but the doc said your heart won't tolerate surgery, so you're screwed. So what you're going to do is we got to peacefully coexist with them. We got to get them unloaded. We got to do the best we can. Even Mr. Johnson with severe OA and his state of having heart problems and all that, he could still get some long axis traction. He could still do something where he doesn't have to take a narcotic. He could, there's a million things. We just got to go evaluate and see what he can do, but there's always something somebody can do. And my big thing, and I won't go off on this too much, just a little bit, is it's like we read this literature review that says, well, you got this hip OA, this doesn't work and that doesn't work. There is a human connected to this hip problem, right? There is, if we don't move, we die. And that's just the way it is. Your chances of bad things happening to you go up dramatically when you don't move 30 minutes a day. And it's not that dramatic. Divorce happens with chronic pain, suicide happens with chronic pain, all these bad things can happen. We just got to remember that our job is not necessarily to make their hip OA better. We've just got to help. We're in the best position as experts of movement to figure out how to get them some joy and some movement in life. That's where my passion is.